Hi there, Dr. Kelvis with Liberty Family Medicine here to talk to you about your gut health. So I have patients every day that ask me about, ulcerative colitis or Crohn's or questions about their irritable bowel syndrome, and it always comes down to what are you eating? There's a lot of studies to show that high doses of antibiotics creating, Crohn's and things as you get older. Unfortunately, now so much of our food is processed. So try to get away from the fake processed things. You want to eat foods like vegetables with a lot of color. Um, I've seen patients with debilitating diseases like muscular sclerosis and things. I've seen them totally come off of their medications just by changing their diet. You can completely reverse type 2 diabetes if you follow something called the Mediterranean diet. A lot of my physician colleagues are actually vegan. I was vegan for 1 year, and it was probably the best I felt that whole year. Um, so there's so much literature coming out about the microbiome. And so, for example, after you have a heart attack, um, parts of your bowel, for the little bit that you're actually having the heart attack, they don't get enough blood. And so certain bacteria actually die or they change in your gut. And what we're finding is it's that change in the gut flora that causes that resistant depression that people suffer post MI. And we don't know how to reverse that. Um, so, in chronic disease, diet has a part to play. Absolutely, always. You can always improve anything you struggle with. Doesn't matter what kind of, whether it's psoriasis or you've got cancer and you're on all these big drugs and steroids. Um, so a new drug that just came out. It is $400 a month. It's called Visipa. It is, ready for it, 4 grams of fish oil. You can buy that over the counter for nothing. Fish oil for thousands of years has been used to treat high cholesterol, and it's good for your heart and coronary artery disease and all of those things. Um, I actually, if I had the time and the resources, I would actually get maybe like a fellowship or something in functional medicine. I've done a lot of reading on naturopaths, and they have a lot of really good feedback. So, would I recommend seeing a dietitian? Sure. I mean, if you need an initial consult and help, but I think a functional medicine physician is better long term, for your gut health. But if you're not having regular bowel movements every day, I have patients that will have maybe 1 or 2 bowel movements a week. I don't think people realize how bad they feel until they fix all of that. There's a lot of great things you can order, like blood sensitivity panels that will, so they test you against 400 types of food, and they measure the inflammation that each of these food triggers. And patients that have really bad irritable bowel disease or syndrome, when they avoid that list or they change their diet that way, all their symptoms go away and they get to come off all of their medications. So ask your physician about gut health and the microbiome.